According to Christian Anderson of Scripps Research Laboratories and author of the definitive and most often cited research paper on the proximal origins of the novel coronavirus, the emergence of the COVID-19 epidemic in the United States went largely undetected due to inadequate testing. Directing early focus for the readers on the need for increased investment in adequate testing for early detection, which to a reasonable person may pass the muster of being proactive and good business decision. However, Anderson also goes on to inform the reader that not Washington state, where the patient zero had been identified as the first reported case of COVID-19, not entering the United States on the West Coast at either of the most expected points of entry, somehow being evasive and invading the most populous centers for persons with Chinese ancestry, i.e. Los Angeles and San Francisco respectively, and completely bypassing Hawaii. New Orleans had experienced one of the earliest and fastest accelerating outbreaks, coinciding with Mardi Gras in March of 2020, 2 months after the first reported cases in the continental United States. Anderson, therefore, set out to gain insight into the emergence of SARS-CoV-2 in the U.S. and how large-scale events accelerate transmission, and decided to adopt the clinical method of sequencing, which always sounds scientific, SARS-CoV-2 genomes during the first wave of the COVID-19 epidemic in Louisiana, and had, in a form sufficient to pass certainly the muster of peer-reviewed research, demonstrated that SARS-CoV-2 in Louisiana had limited diversity compared to other U.S. states, and that one introduction of SARS-CoV-2 led to almost all of the early transmissions in Louisiana. Anderson wrote, analyzing mobility and genomic data, we show that SARS-CoV-2 was already present in New Orleans before Mardi Gras, and the festival dramatically accelerated that transmission. Citing to guidance from the Centers for Disease Control and Prevention, Anderson presents the clinically suspect, at least to the inattentive ear, the claim that although SARS-CoV-2 was first detected in the United States in January 2020, mid-January, the majority of the early COVID-19 cases were associated with travel from high-risk countries or close contact with travelers, which may conform to your understanding of the disease as well. For those not familiar with reading a scientific report, especially one like this work with lead author Mark Zeller identifying that person as the most responsible for leading research, and with Anderson's name added to the tail end of this string of many authors, noting that his laboratories, Anderson Research Laboratories, a new subdivision of Scripps Research Laboratories, had provided the predominant portion of the research facilities. This phrasing suggests confidence to the casual reader, but provides some latitude, or shall we say wiggle room, to use the phrase coined by Anthony Fauci during the pandemic. Note that Anderson only claims that travel had been associated with close contacts with travelers, which to a clinician re-emphasizes that conversely causation implies association, but not correlation. While that is a point that you would have to probably just parse the syntax to totally understand, just like how the virus, the CDC had suggested that the virus was thought to be spread by coughing and sneezing and droplets at the beginning of the pandemic, but use the passive voice because that was not necessarily a proposition that they were standing down on, but noting that many people believed or just thought that was how it was spread. Anderson goes on from here, however, to posit that in 2020, by late February, widespread community transmission of SARS-CoV-2 in the U.S. was identified in Washington State, New York City, and Santa Clara County, California. But it is estimated, or had projected, or hypothesized that local transmission in the U.S. started earlier and was more widespread than recognized at the time. It's not a statement of fact, as much as a hopefully educated guess. And according to Anderson, elsewhere outside of these early virus hotspots, in the U.S., transmission of SARS-CoV-2 occurred mostly silently due to lack of testing until the second week of March, which he states without conditional hedging is a statement of fact based on no empirical tests, presumptive or confirmed cases in any database of itself suspect to at least see critical reader. And by mid-March, much of the United States had commenced draconian lockdown mandates, a full month after in China, as reported by the WHO. The lockdowns, which had been limited to Wuhan and only a few areas in the surrounding Hubei province, had begun to be rolled back after only 1 month. And as reported by the WHO, after completion of a robust investigation involving 1,800 teams of at least 5 epidemiologists, examining 55,924 laboratory-confirmed cases of the 75,464 known reported cases in China by February 20th, 2020, an investigation of a scale that has never been replicated in the United States, which is 19 times more cases examined than had yet been reported in the entire United States by mid-March 2020. According to that 40-page report, about which even its author, Bruce Aylward, assistant WHO director, had diplomatically suggested that he didn't think people, even under the evolutionary pressures of a lethal pandemic, was approaching, were paying close enough attention. According to the WHO, and warranting their praise, China was already and rightfully working to bolster its economy, reopen its schools, and return to a more normal semblance of its society, in clear contrast to what was beginning to occur in places like Arlington, Virginia, home of the most government scientists and the most educated municipality in the state of Virginia, where on report of at most 5 cases, most presumptive in the entire county, education leaders had been announcing their plans to cancel in-person instruction, rejecting the science-based, risk-informed, and phased approach taken in China, with a clear recognition and readiness of the need to immediately react to any new COVID-19 cases or clusters as key elements of the containment strategy were lifted. And of clinical significance, Anderson reports that in contrast to the emergence of inherently more transmissible virus variants in the fall of 2020, beginning of the Delta variant emergence and beyond, in the early phase of the epidemic, transmission was mainly driven by favorable epidemiological circumstances, because, at least to his mind, it had at least appeared, upon hasty observation, but without any empirical testing done, that it was only likely that large-scale events in this period dramatically accelerated early SARS-CoV-2 transmission, and that subsequent interstate seeding amplified the COVID-19 epidemic in the U.S. And perhaps today, even still, many believe that was how it occurred. Medical researchers describe these as congregant settings, congregations, churches, because persons tend to congregate in gatherings, making it plausible to do so that persons are transmitting infections between one another. However, this is only a tentative conclusion based upon just observation, like person in a magic show, which Anderson emphasizes in his report by only stating that this was only likely.
This message was approved by Major Mike Webb. This has been a Filmways presentation, darling.
And y'all go back now. Yeah.
Honest.